And good afternoon, everyone. Thank you for joining us today for our March training. My name is Karan Phillips, and we're happy to have you here with us. I'm joined by my colleague, Megan Wolf, and we would like to acknowledge that this work is done with the generous support for our partners at the Johnny Harper Foundation. Yeah, my little clicker. Sorry, everybody. There we go. Please keep your devices muted during the presentation so we can avoid any background noise, but do feel free throughout the presentation today to put your questions in the chat. Throughout this session, there will be time at the end for us to engage with our speaker and ask them questions. And your feedback is very, very important to us. We kindly request that each participant take a few moments to complete an anonymous feedback survey that will appear on your screen as soon as you exit out of our training today. Your insights will be shared with our evaluation partner, the New York Academy of Medicine, and will greatly assist the TIFA team on enhancing our future trainings. So as most of you may know, TIFA is a public health policy research and advocacy organization dedicated to optimal health for every person and individual. TIFA produces several reports annually, including Ready or Not, which focuses on emergency preparedness, pain in the nation. Related to our healthy aging work, we have produced reports on several topics, including rural healthy aging and the 10 public health essential services. So this year, our training series is all about the age-friendly ecosystem and public health's role in helping to advance multi-sector engagement. As we continue on with this series, we want to provide you with a working definition of the age-friendly ecosystem, which I will actually put Megan on the spot to talk about the age-friendly ecosystem briefly.
Sure, I'm happy to do that. So yeah, we've been working to expand collaboration across the ecosystem and have identified this kind of working definition, and we've seen different definitions of the ecosystem. But right now, we consider it a multi-sectoral network of practitioners, providers, and organizations that prioritize improved quality of life for older adults, their families, caregivers, and communities through collaborative impact. And you can see the graphic on the screen here that that lists or shows some of the sectors that are currently in the ecosystem that we're working with. But this list or grouping of sectors is not exhaustive. There may be other sectors that you're working with that we haven't considered or we haven't been able to partner with yet, and that's great. But this is just the group of sectors that we're currently working with, and they include public health, of course, but also healthcare systems, academia, cities, communities, states, and counties, home and community-based services, which is the Aging Services Network, and workplaces. So, so this is where we are. This is where the work that we've been sponsoring and trying to expand over the last, I'd say, year and a half or so. So, is there another slide on the ecosystem, or is that it?
That's it.
Okay, great. So we met Tauhric Brown last year. We supported facilitated a workshop on the age-friendly ecosystem, and we wanted to elevate some case studies and highlights of work that was happening in the field and across different communities. And Tauhric Brown was someone who was introduced to us as a leader in the aging services sector in Indianapolis. Tauhric has since left that particular association, but has had such a great message in terms of building trust and building that foundation of buy-in with other organizations to do this work that we invited him to present today. So Tauhric, I will turn it over to you, and thank you again for being with us today.
Thank you so much, Megan. It's, as I said, great to be here, great to be supporting TIFA in this effort. Good afternoon, everyone. My name is Tauhric Brown. As you see on the screen, my beard's much, much lighter than what it was there. I've trimmed it down quite a bit, and I've shaved a few pounds since then, obviously. Karan, could you go to the next slide, please? So today, as Megan said, I really wanted to share with you some foundational things that I have found have worked for me in my personal life and professional life as it relates to building good trust and relationships, and really demonstrating through some case studies how those interactions really do drive cross-sector collaboration. Next slide, please. And to get us started, I always like to say, here's our agenda for today. First, I'm going to share a little about me. I find that I've never met an audience where there's not common ground based on my lived experiences, and I'm going to try and connect with my audience. Then we'll kind of dive into some of these foundational concepts that I have held true in building trust. And then we'll unpack what I consider the 13 behaviors of a high functioning or high functioning relationships. And then we'll share a little bit in that cross-sector collaboration to kind of give you a sense of it in action. I will say that much of what you're going to hear from me today, some of it comes out of a book that I read several years ago. A mentor of mine suggested that I read a book that Stephen Covey wrote several years back called The Speed of Trust. And I don't know if any of you have read that book before, but just know some of what you're going to see here is derived from that book, some of those concepts. Karan, next slide, please. So a little about me, I'm a huge man of faith, as you see here on the slide, and I like to think about my professional journey as seasons. Right? Ecclesiastes 3:1 tells us that all seasons come to an end. And I have enjoyed 3 complete seasons, and I'm in my 4th one. My first season, as you see, I was in the military. I was a personnel guy who got to travel the world, help soldiers on the non-commissioned and commissioned side of the aisle, and got to see Stuttgart, Germany, Doha, Qatar, Aberdeen, Maryland, and Michigan was my final duty station. The second season was in retail. And I fell in love with retail because of the interactions with people. That's what filled my bucket every single day, and I enjoyed that. While I was in retail, though, I owned a dealership for 9 years. I was the regional guy, national guy for a concept called BlackBerry from Wireless Giant. So if you traveled in airports domestically, when BlackBerry was in its high day and traveled through Hartsfield International, Boston Logan, Philly International, MSP, Charlotte, or Bush or Houston's Bush International, you may have seen a BlackBerry from Wireless Giant store. That was my project. And then around 2010, I started to feel like God put me on this earth to do more meaningful work. Yes, I loved sales. I loved the passion in meeting people, but I felt like I wasn't making the kind of impact that I was put here to make. And growing up, spending every summer in Atlanta with my grandmother and my oldest aunt who was disabled and lived with our grandmother her entire life, put a passion in me at a young age for older adults and people with disabilities. So when I made my transition to that 3rd season in the nonprofit sector, I was blessed to find an opportunity in the aging and disability space. I started with a service provider in West Michigan as a division director and then COO. And then I was hired to lead the largest area agency on aging in Indiana called Sequoia Aging and In-Home Solutions from 2020 to January of 2025. And now my final season is I have launched a business and leadership coaching practice powered by Focal Point Coaching, and am helping make impacts in a much larger way. And so that's why I say those are my seasons. As I mentioned, I'm a strong man of faith. My wife and I have been together married 15 years, been together 18 years. We have a blended family, so I call us the Brown Bunch. There are 6 children, 3 that I had, 3 that she has. And we have 3 grandbabies, with our most recent little girl, Bennett, was born January 31st of this year. Next slide, please. So when I think about building trust, I often think about, can I do that from an economic lens? And when you think of trust as tangible, with a return on investment attached to it, it becomes a pretty powerful statement. As I think about situations where low trust exists, that generally means that productivity is probably lower and your costs are probably higher. When I think about relationships that have high trust, I think about that being high productivity and lower cost. And so, all that to say, there is a way to look at building trust from an economic lens to give yourself a return on investment or an ROI perspective of that. Next slide, please. So, when I think about building a solid foundation of trust, it starts with me, Tauhric, right? And these things on the screen, you can see them. I'm not going to read them to you. I'm going to highlight certain things and how they were either a challenge for me or was easy for me to wrap my arms around. And so when I think about that trust building, am I able to be authentic and genuine with whomever I'm talking to? Am I vulnerable? Can I take my walls down and really share my pain points, what's working well, what's not working well, etc.? Can I meet this individual on common ground? And I always believe lifelong learners win. Now let's kind of dig into these just for a moment. Bringing that authentic and genuine self to the table, from my perspective, is a critical first step in beginning to build trust. This is the step where I have always thought less about me, my agency, my division that I was leading, and more about the common shared purpose or goal that I'm pursuing with this partner or agency or company that I'm looking to collaborate with. When I think about being vulnerable, I think about that being an important second step. And this is where I have to know, do I have the capacity to take my walls down? And I want to take you back. Remember, I spent 15 years in retail, cutthroat, dog eat dog, very different world than the not-for-profit sector. Those first two were very hard for me to transition and adapt to. Why? Because in the nonprofit world that I found myself in my third journey, everyone is civil servants. They have servant hearts. They don't have hidden agendas or motives. But in the private sector, those things are very much part of that world. So it took me a while to just take my walls down and have some very frank, candid conversations with external stakeholders that I was engaging with. Having that common ground, I talked about that a little bit, right? Trying to identify what things are common. It could be as simple as a TV show. I might be talking about how I used to roller skate in the late 70s and early 80s as a teenager, and it might pop in someone's mind, go, oh yeah, I did that too. That's common ground. That's something that we can build on. So try and always have your ears open, listening for those common ground moments so that you can leverage those as a way to build solid foundational trust. And when I say lifelong learners win, I want to tell you exactly what I mean by this. I say lifelong learners, those willing workers, those individuals who get up every morning to say, I want to learn something new today that I didn't know yesterday, I believe stand a better chance of success in building great trust with others. Why? Because lifelong learners take the time to research. They take the time to study. They take the time to learn about who I'm going to be meeting with. Is it an individual? Is it a team of people? Is it a company? And I want to go in there having good knowledge, at least about what it is they do and what their why is. And I say it's less about the what and more about their why. So lifelong learners combined with being authentic and genuine, taking those walls down and being vulnerable and trying to meet on common ground are four very critical steps that I have always utilized to build a solid foundation of trust. Next slide, please. And so once that trust is built, we now want to find what are those behaviors that really drive great and high effective relationships, that relationship trust, that other currency that we need to have. And these 13 behaviors, there's some on this slide, the rest of them on the other slide. Again, not going to read them to you, just going to highlight some very critical things from my perspective that I'd like you to think about. Talking straight, say what you mean. Sometimes that's hard, but you have to say what you mean. You have to let people know where you stand, and you have to use simple language. Let me give you an example of simple language, folks. I remember when I first started in the aging sector, and I remember day one, I'm in orientation at Senior Services in Kalamazoo, Michigan. And the CEO is talking to me, and he said, you know, Tauhric, we're going to have to get you scheduled to meet with the Kalamazoo AAA executive. And I looked at him and I said, Bob, what does a car insurance company have to do with the work that we do? AAA. I knew AAA as an insurance provider. He was talking about area agencies on aging, but I'm day one. I wouldn't know that. So when I say speak simply, that's what I mean. Don't use acronyms, because if it's someone who's not in your world, they likely are not going to understand what that acronym ties to. Demonstrate respect. That old adage, treat others like you want to be treated, right? It's just very simple. Create transparency. This is a difficult one. And I still, with the long career I've had, it's a challenge at times, because creating an environment of transparency means you can share to the extent that you can. At certain levels and certain things that we usher, sometimes we can't share all the details because all the details aren't known. So when I say create transparency, I say create transparency, create that environment to the extent that you're able to, though. And that doesn't mean you can't tell your team or your second in command. There's too many unknowns, so I really can't talk about that. Yeah, absolutely. There is a difference between secrecy and discretion. Thank you for elevating that, Megan. That is 100% correct. Right wrongs. Right wrongs simply means that as we design things, as we try things, as we do things, there's a possibility that it may not go exactly how we mapped it out. That's okay. But what's not okay is for us to not, again, it's my perspective, to not own our part in that. Shouldn't have done that way. Got to make sure we think about that differently this time and move forward that way. So right wrongs is one of those where it's there. We know that things are not always going to work out. This is an imperfect world. We're imperfect, humans. Mistakes will happen. Things will get missed. I think the point I'm making is when that does happen, we as individuals must go, this is my part in it, and this is what we do to right that wrong. Delivering results and showing loyalty is exactly that, right? When I think about showing loyalty, I always like to reward in public, have constructive feedback discussions in private, right? That shows loyalty. Always giving credit to those who have gone down that road and gone down that road of doing something positive. I want to make sure I celebrate them in public, etc. Delivering results is simply getting the results and executing and implementing what it is that you have been charged to do. Next slide, please. And then, of course, here are the remaining ones for those 13 behaviors. Get better. To me, I think about getting better as always being in a constant state of continuous improvement. Everything that we usher, lead, or involved in has the ability to be improved. As I said, this is an imperfect society. We're an imperfect people. Processes are not perfect. Everything at some point can be improved. Confront reality. This is more for those challenging times, right? There are certain realities out there that may not be very positive or favorable, but confronting those realities versus pushing them to the side is always a great behavior to emulate from that relationship trust. So, that could mean if I've got bad news to deliver to one of my strategic partners, I can't skirt that. I've got to get that bad news to them as soon as possible, and so that we can talk through it and formulate what the next step is. Clarifying expectations is extremely important. We all know what we want, but the question is, are we articulating that to those who are carrying out those items as efficiently and effectively and with the clarity needed to make sure that we can get as close to hitting the mark as we need to? Practice accountability. I think someone put in the chat, righting wrongs equals accountability. Very much so. Practicing accountability means I'm practicing it on myself, so that as I practice, and when I coach leaders, I say practice it, practice it, practice it, so that when you have to play it out, when you have to do it in real time, it doesn't feel yucky. It doesn't feel threatening. It doesn't make you feel nervous or afraid. So practicing that accountability really does help us put that accountability, holding others accountable, into play to give us the best outcome that we may want. This is a tough one for me. Anybody that knows me, Karan and Megan, are probably going to smile when I say this. Listening more often, listen first and often, that was never me in sales, right? It's sales. You have to be the person that's doing the talking. So when I moved into the nonprofit sector, I had to recondition myself. I had to reinvent myself to be able to listen more, right? Listen first and as often as possible. And so I'm still a work in progress there. I'm not perfect by any stretch of the imagination, but I am committed to constantly doing more listening and less speaking in many different situations that I'm in. Honoring commitments is simple. If you say you're going to do it at this date and this time, make sure you do it at this date and this time. And then that last one is extending trust. And what I mean by extending trust is once you have worked to build that trust, you now want to extend that outwardly, externally to others. But you want to make sure that as you extend your trust, you've got conditions around that trust so that if it is damaged, I say trust is one of the most difficult things to build and the easiest thing to destroy or damage. It can always be rebuilt, but we never want to get to a place where it's been damaged. So there has to be, those boundaries around extending trust to others to make sure that we don't get to a place where it's been damaged. Next slide, please. So let's talk about some case studies, because I know that's what we're all here to really see and hear about. I'll say that there are two that I'm going to take you through. Both of these cases kind of took place during my tenure at Sequoia Aging and In-Home Solutions. But there is a third one that I do want to elevate that may not be displayed here and is probably the most important one. It is my participation in the age-friendly work group. And so when Megan invited me to join that body and attend that workshop last year, it was amazing. Walking in that room and seeing all of these different disciplines, professions, sectors represented was absolutely phenomenal. And when I left there, I was very much charged up to do more, get more involved, right? So when I went back to Indiana after that, I started connecting with our local AARP team. Sarah Waddle is our AARP state director. Amber Marr is the director in Indianapolis proper. And we started having some dialogue, and come to find out, I found out that two of our municipalities in central Indiana had executed LOIs to begin developing age-friendly communities back before COVID. And then when COVID started, they kind of paused all that work, but they're now in a place where they're starting to bring that back up. And the reason it's relevant for this body and for this discussion is because now that I'm a sole proprietor on my own, I have more time to invest with the local mayors, AARP, community-based organizations, economic development districts, and housing entities to start to figure this out on a more grassroots level in Indiana. So I'll say that first case study is really the age friendly, my involvement in age friendly and what I've learned so far and how I plan on leveraging that for a better path forward in Indiana. The second one that I'll talk about is it focuses on the health system collaborations that SECOA had with the 3 partners listed here. And the second one I'll talk about specific to Marion County Public Health Department. So next slide, please. So as we gathered here, this again is from my age-friendly presentation, as we gathered together to talk about our age-friendly ecosystem, I really wanted to share what SECOA has done in that healthcare collaboration space. First, I'm going to explain why it makes sense for healthcare, social care, public health, health plans to work together for aging, disabled populations. And then I'll dive into the ways we're working to bridge the gap between those 2 sectors. Finally, I'll show you where we're headed next. Next slide, please. So as we look at this slide here, there's some information here, but essentially what this slide is communicating is we have known for a very long time that 80% of health outcomes are derived from social. Can you go back a slide? I don't know why it advanced. That was odd. We know that 80% of health outcomes are derived from social determinant of health interventions. And the remaining 20% come from those traditional clinical health care settings. To truly improve health outcomes, we believe we must adopt a holistic approach, one that considers not just medical needs, but also social and environmental factors. We can enhance overall well-being and reduce healthcare costs in the long run. Addressing social determinants of health does require a collaborative effort, one that harnesses the community resources that serve as lifelines, connecting individuals to services so that they can thrive in their environment. And since the vast majority of health happens outside of traditional healthcare settings, what is important here is that there aren't a shortage of organizations, community-based organizations, area agencies on aging, et cetera, that aren't able to contribute in some way, shape, or form to that great work of a holistic approach. When I think about the challenges of building something like that, it immediately takes my mind to the data components, and we'll get into that in a little bit. I saw the comment that just hit the chat, and that 80%, 20%, that is a statistic that has been out there and widely known. It's talked about at various levels. I don't have the specific source for that, but we can certainly get that. But that is a statistic that has been out there probably for the last 15 to 20 years. And it's how do we build these, converge these worlds closer together to be able to see how the impacts of social determinants of health and the clinical interventions, how they really are moving the needle. Next slide, please. So SECOA has successfully partnered with these health systems on the screen in our area to address social determinants of health for patients who demonstrate a need for in-home services. Through these partnerships, one of our social workers is embedded directly into that hospital system or physician clinic that they are assigned to. And what happens is they are working with the discharge planners to then assess that patient who's being discharged, develop that social care plan, connect the services to that individual, and then provision and ensure that they audit and monitor for compliance of that care plan. They also assist in the transition to home or facility after discharge. What this model has done it has significantly transformed and improved the quality of life for many of our seniors and the seamless communication between providers, SACOA, the health system, and the patient has also been enhanced and improved as a result of that. Next slide, please. So as you can see, the year program that we had run, we kind of began collecting data as baseline. And then what we did was we, started really looking at some measurable things. And what we found, thank you, Karan. And what we found was we saw a 44% reduction in ER visits. We saw the reduced visits to emergency room. We saw better chronic disease management. We saw improved nutrition. We saw strengthened preventative care, and we saw increased health equity. Why? Because we were able to see what was happening on the clinical side as well as on the social care side. Here's one example I'll say. Miss Janie's A1C reading was really high. If we had vision on that, our nutritionist could then go, okay, can we reach out? Do we need to reach out? Or one of our public health department partners might reach out to that client to see if they could help address that. So there are always ways that social care organizations try and help improve those outcomes. On the preventative side, it might be, I'm not as mobile at home as I used to be. Maybe I need to have a grab bar or a handrail installed in my bathroom to make it a little more sturdy. That's a fall prevention thing, right? So understand those kinds of interventions really do help to improve those health outcomes. Next slide, please. And so as I mentioned, what's next is it's the data sharing. There was always that challenge of, do we trust a community-based organization? I'm speaking as a health system or a managed care entity. Do we trust this smaller community-based organization to enter into data sharing agreements and arrangements with them? And many organizations like AAA's and smaller community-based organizations doing SDOH interventions unfortunately don't have the resources to become high trust certified or ISO SOC 2 certified. And so it becomes a challenge or a hurdle for them to do that. So, one of the ways that we were able to address that was committing to doing quarterly penetration tests, right? And those quarterly penetration tests and showing those results gave another level of comfort in building trust in getting to data sharing arrangements. And so those data sharing agreements are in place. It's not fully bi-directional, but at least there is some vision on some of the clinical and social care interactions that we have with shared patients of our health system clients. Next slide, please. And so here are some of our healthcare collaboration kind of, pictures that I wanted to throw out there. On the left is me and one of the directors of nursing at Oak Street Health, which is one of the hospital systems that we connected with. And then over here to the right, this is not so much health system driven, more so age friendly driven, because the person, one of these individuals is Sarah Waddle, who is our AARP state director of Indiana, and the other individuals, one of the AAA CEOs out of Fort Wayne, Indiana, who also operates the PACE program. Next slide, please. And then here are some additional photos of some, awards that we gave out to some of our providers of DME products. Again, more of that collaborative network that we were building out at SACOA that brought providers, health systems, various partners to the table to really help that shared constituent have the best outcomes that they could possibly have. Next slide, please. Marion County Public Health Department. So this is a really interesting one, and it's really interesting because you're going to be able to see, I hope, from this story and you know, as I wrap up here, I hope you'll be able to see the steps that I had to take in order to get the kind of relationship in place with the Marion County Public Health Department. So when I got to Indiana in 2020, we had a relationship with our local public health department in Marion County, and we had a board member that worked at the health department as a board member of SACOA. And Tauhric was thinking about building those relationships with, do I have allies that are on a board or committee of mine first, right? Because let's not forget, I started January 6th of 2020 and COVID hit March of 2020. So it wasn't a lot of face-to-face things that I was able to do. But one of the sacrifices that I probably shouldn't have made, I can say that in retrospect, is since I had someone who worked at the Marion County Health Department on my board, I put building a specific relationship with Dr. Virginia Kane in the back of my mind. I took for granted that that relationship was solid, that the trust had already been built, and I was wrong. And so for my first 2 years at SACOA, we did some things with the Marion County Health Department, but it wasn't to the scale and scope that I thought it could be, until one meeting I had with a former health department employee. And I sat her down and I said, Diane, I just don't understand. What's happening? Why am I not able to get in front of this? And she said, Tauhric, what's your relationship like with Dr. Kane? With not with Marion County Public Health Department, with Dr. Virginia Kane specific. And I said, I probably need to work on that. I knew the answer because I hadn't done that work yet. You turn to the next year and a half, that is what I did. I got to know Dr. Virginia Kane very well. She's a great, great friend of mine today. But what that has led to is SACOA, you can go to the next slide, Karan. So what that has led to is the Marion County Public Health Department, Indiana has, they received their largest public health investment in the state's history in July of 2023. And Dr. Lindsay Weaver, the state health commissioner, did a wonderful job getting that package over the finish line. And what that meant, and for those who don't know, because I was not aware, public health in Indiana is funded at the local level first, and then the state fills in gaps. So they made a significant investment in public health, and from that, the Indiana Department of Health created what was known as the First Indiana Health, or Healthy First Indiana initiatives, their KPIs. And they created this wonderful dashboard that you could go and look at areas, how well counties were performing. And so I did my research and I looked at Marion County specifically. And I was looking for areas where I knew there were synergy or collaborative opportunities between SACOA and the Marion County Public Health Department. And it was in these spaces, areas that you see on this slide. It was in information and referral. It was in fall prevention work. It was in chronic disease management with a focus on diabetes. And it was evidence-based wellness programs. Had I not taken the time to build foundational trust with Dr. Kane and really to build a great relationship with her, I believe SACOA would not have gotten, you can go to the next slide, Karan. I believe SACOA would not have gotten the $540,000 grant that they received in December of 2024 to focus on those 4 items that were on the previous slide. I believe that we would not have been in a position to give awards out. Over here to the left are some elected officials who were instrumental in getting that public health funding across the finish line in the General Assembly. And this right photo in the dead middle. So you see the person that's not in the green t-shirt, that is Dr. Virginia Kane. Now, she wasn't even scheduled to come to our event last September. She was actually en route to another meeting and took the time to stop to say hello, to see how things were going. And when I said to her, Virginia, we don't have enough dumpsters to remove all the debris that we're picking up, she called the Marion County environmental team and they came out there with their trucks and their crews and they helped us. That wouldn't have been possible without great relationship building and great foundational trust. Next slide, please. And here's some additional photos of, our Safe at Home event and some other events. The person sitting next to me, that's Sonia. She is the Marion County Public Health Department employee that sits on SECOA's board. And so that's why she's displayed here. And next slide, please. I believe that should be all of them. Yeah. So, hey, I did pretty good. Got 18 minutes for questions. That's great.
That's awesome. Tauhric, the one of the first questions that that came, and I have some questions of my own, but one of the questions is, what's the process for building trust? Like what does that look like? Is it a one-on-one conversation? Is it a series of one-on-one meetings? Like what is the actual process for developing relationship and building trust?
Yeah, I think that the actual process, it's best done one-to-one. That's what I have found, Megan. And it's real, I'll say it this way. I've never met a person that I didn't want to meet, right? I'll meet anyone, I'll talk to anyone. That's not generally how it works for everybody. So what I would say is, let's go grab coffee, right? That's always a great one. Let's break bread. I see someone put, let's break bread. Let's fellowship. Let's just get to know each other. And I think the key with building trust, from what I have found, is it's less about the professional and more about the personal. In other words, if I approach with, oh, I've got a business idea, that doesn't work. But if I approach as, hey, I've heard a little bit about you and would love to hear more, would you like to grab coffee sometime? Right? It's just that simple, but it's also a challenge. If you're not an extrovert, right? For the introverts, I can't really guide them because I'm not an introvert. I am an extrovert to the core. So it's challenging there. But I would just say, just reach out to people. If there are individuals in your world that you'd like to know more about, get a hold of them. I mean, their social footprint is probably LinkedIn, Facebook, Instagram. You probably can get an email or something for them. I might start with an email. I generally choose to reach out via phone because I find that that's an easier way. Nowadays, people don't answer the phone as much as they used to. So that's
they really don't. Yeah.
Yeah, maybe a text or an email to them. I know that's a round the bend answer, Megan. There's not a specific way, really. It's what's your comfort level, and lean into that comfort level would be my advice.
Yeah, and I find that people are very willing to talk about their own projects. So like if there's a project that, what are you working on? Oh, tell me about this toolkit you developed or whatever it is.
Yes.
Yeah. So what if you reach out to somebody and they're reluctant to meet you for whatever reason, and this is someone you really, really need to make that connection with? What's your advice?
Yeah, so if it's a situation like that, my advice would be, if the front door is not open, find a cracked window or a cracked back door. And let me explain what I mean, Megan. So I've experienced that myself. In fact, I recall trying to get in front of one of the plan presidents of one of the MCEs in Indiana, and she just wouldn't meet with me. So what I did was, I knew one of her team members very well. And I said, so where does old girl like to get coffee in the morning? And I showed up there and just, hey, how you doing? And just kind of started a conversation there. So when I say if the front door is closed, try and find a cracked window or a back door that may be open to try and get, get that introduction or get a meeting with that person.
Yeah, that's great. And I'm generally an introvert, although I can do meetings like this, but I'm generally an introvert. So I might be intimidated by I don't know, an extreme extrovert. But I appreciate the approach. Other questions that folks have? Please feel free to come off of mute and turn on your camera, or just put your questions in the chat, and we'll ask Tauhric to respond to them. So I did have a thought when you were talking at the very beginning of the 13 behaviors. One of them you said was vulnerability.
Yeah,
And vulnerability can be risky,
it is.
right?
Yes.
So do you have an example of when you made yourself vulnerable and how that worked out?
Yeah, I absolutely can. This would have been August of last year. I had a breakfast meeting with some senior policy advisors from Bose Public Affairs. And one of the individuals at that meeting happened to be on then Senator Mike Braun's transition team for governor. He was at that meeting. He was going to be, and since has been named, the secretary of the Family and Social Services Administration.
Oh.
And he asked me a loaded question. And the loaded question was, so Tauhric, how many area agencies on aging exist in Indiana in 5 years? That is now I'm the CEO of the largest AAA in Indiana. That's a difficult question. Vulnerability is, for me in that moment, I had to throw it back at him, Megan, and say, that's an interesting question, Mitch. Help me understand what it is you're trying to accomplish. So I made him answer that question before I took my walls down. Here's what he said. Well, I think there are too many of them in the state of Indiana. There's 15, and there's 6.8 million population. And I believe there shouldn't be as many. And I said, okay, so what's your ideal number? And he said, I want 1.
Wow.
And I said, okay. I said, Mitch, and I said, you do know that's probably not going to happen. ACL, he's like, yeah, I know federal rules. I get that. I said, are you saying you only want 1 area agency on aging, or are you saying you want 1 single source contracting option for all of the contracts the state unit on aging does for the AAAs? He said, that would work for me. Okay, now I can take my walls down a little bit more and talk about that solution with him. So you are 100% correct, Megan. Every situation is very different. Gut feelings are still going to carry the day. If I'm in a conversation with someone and I've got a gut feeling that there's something under the hood to this conversation, I'm less likely to take my walls down and be vulnerable. But at some point, I've got to go, okay, either I'm going to get comfortable with what I'm uncomfortable with here, or I'm going to walk away from this interaction and not pursue this any further because I'm uncomfortable. I can't take my walls down enough in order for me to move this forward.
So were you able then to develop a single process for that contracting? Because it sounds like that was an opportunity for a great solution.
It was. We are very close to having 2 opportunities come through the Family and Social Services Administration. One is it's a Medicaid diversion pilot. We're trying to delay how quickly someone needs to occupy a Medicaid waiver slot in Indiana. And then the other one is one of the contracts that the AAAs get. We're trying to have the Community Care Hub of Indiana oversee that contract and receive 1 contract from the state to then push out 15 subcontracts to the agencies that would be doing the work. We haven't gotten that final decision yet. Indiana is very much about the legislature. So these are things that are in bills right now. and they're in session. So should some stuff get stripped out, it may not go exactly how we want it to, but those are the two immediate opportunities that we have in front of us.
That's great. Thank you for sharing that. That's a good
Yes, ma'am.
example. Any other questions, or does anyone have an example of how you implemented any of these behaviors or other processes to build trust across sectors? All right. Well, I've been trying to practice giving some space for people to share any additional thoughts that they have. But seeing that there are no further questions, Tauhric, any final thoughts that you may have for us? Any advice?
Well, I would first again thank you for allowing me the space and opportunity to have this conversation with the group. I just leave you with building trust. It's scary. I still say that it's scary. And then, focusing on some of those behaviors, right? It's not all what you've seen today. You all know, right, what works for you. I'm not suggesting you adopt what I've shared, but if there was something that might have resonated, I would say and suggest put it into practice for a while and see if you get a better result than what you're currently getting. Because as we all know, the definition of insanity is doing the same thing over and over again and expecting a different result.
Right, right. Exactly. Yeah. Thank you so much, Tauhric. As always, we learn so much from you, and appreciate that you're in even another journey in your life, but
Yeah.
that you were able to come back and share from your previous journey. So we really appreciate your time and effort here today. Karan, I will turn it over to you to close us out.
Thank you again. Thank you. Thank you so much, Tauhric. I was reflecting, and I didn't want to hog the mic, but I was reflecting on my time working in affordable housing in the time of building up trust between developer community and academia, and having needing to speak different languages, and there was a lot of bread breaking. Let me just put it that way. There was a lot of bread breaking, a lot of coffee, a lot of meals, but that definitely resonated with me. Shared spaces and coming to that table one-on-one. Thank you all again for attending today. Our next training will be on April 17th at 3 p.m. Eastern Standard Time. You can find the registration for that on our website under events, afphs.org. And if you are attending this training or you're viewing this training, now is the time to note that you have viewed this training. Please, if you're attending now, please note that you've attended by navigating to the website listed, or use the QR code to capture your attendance. And if you're viewing this as a recording, please pause the training now to note that you have viewed this training via our survey as well. And with that, thank you all for joining us today.
Thanks, everyone. Take care.